Good afternoon, everyone. Thank you for joining us. I know we've unfortunately scheduled this to be at the same time as the football, so thank you for joining us. We really just wanted to take this opportunity to discuss some of the changes we are planning in how we will be contactable moving forwards, specifically looking at adding in additional contact routes with online consultation services. My name's Matthew. I'm one of the partners at the practice. With me this afternoon, I also have Elaine Reid, one of our AMPs.
Good afternoon, everybody. Thanks for joining.
We've got a short presentation to run through that just details some of the changes that we are planning. There's a little bit of a video that also just shows some of how that works. And then we will have an opportunity for you to ask any questions that you might have about some of these changes that we're proposing. Just get that presentation up for you all now. So the big change that we're looking to make is implementing an online consultation service called System Connect. That's a service that is that's been created by the IT system that we currently use, System 1, and interacts with like the NHS app, our website, our clinical system, and various other systems. So it's got all the information and interacts with your patient record very nicely. What this will allow you to do as a patient is contact us online, saving that need to telephone us to go onto triage. So the changes we'll be looking at implementing is we will be turning System Connect on for all of our patients from the 17th of July. Initially, this will be a 3-month pilot so that we can see how that works, whether our patients like it, whether our staff like it, and whether it works well for us. What we're hoping is that by enabling this online consultation method, it will reduce that need to be calling us, hanging on the phone. Sometimes, we're aware that it can take a bit of time to get through to us, and we're hoping to make that easier. Through System Connect, you'll be able to make a range of contacts that might be for new conditions, things that need to be triaged. So, coughs, colds, skin problems, anything that would currently go on to triage can come through System Connect. Anything about medications, any queries, side effects, those sorts of things can also come through System Connect, as well as any admin requests. So things like chasing referrals, needing letters or taxi medicals, and all those sorts of things that our admin team deal with. It will hopefully become that one of the sort of key points of access for the practice, allowing easier access without needing to sort of wait on the phone, as is our current system. At the same time, on the 17th of July, we are planning to make a slight change to our phone system. We will be moving from having all the phone calls that are inbound, waiting in one big queue, to having a couple of options for you to select from. One of those will put you through to a reception and allow you to book an appointment. One of those will put you through to a mailbox where you'll be able to leave a message for our admin team, and that might be things about referrals and letters and such, and they will get back to you. And then the third line will be for medication requests. From the 17th of July, we will be changing our policy around medication requests and no longer routinely accepting medication requests on the telephone. This is due to the sort of clinical risk that comes from accepting these requests over the telephone, and where mistakes can often be made in not having a written request of what the patient actually wants. We will still accept telephone requests for those patients that are registered with us as housebound, and we'll detail in a little bit the ways that medication can be requested from us, as there are numerous other options that can be used. A good question will be, why are we making these changes? And the simple answer to that is we are getting busier, and we are busier now than we've ever been before. There's a few stats here for you. In May this year, we answered 6,318 phone calls, and that was up from 5,859 last year. And the demand for our triage appointments is also increasing. So, over the last couple of years, we've seen a 21% increase in our triage appointment need. And that is true across the whole NHS, as everybody is aware of and everybody knows. It's in the media quite a lot. But we don't have an unlimited amount of resource that we can throw at answering the telephone calls and doing the triage. And so we need to look at the ways we're working and make sure that we're working in a way that is fit for modern general practice. And this is a big thing that NHS England are sort of really pushing GP practices to move towards, is allowing patients to have online access so that you can put in a request at a time that's convenient for you. It allows us to get a bit more information from you up front, because we will ask you some questions in that when you're filling out the System Connect questionnaire, and it then speeds up that triage process, so that because we've got that information up front, we're much more we've got much more information on what help you need, and we can direct you to the most appropriate person. That might be one of our team, or it might be for us directing you somewhere else. And again, I've got another slide in a minute that talks about how those outcomes from a System Connect consultation will be communicated with you. What is System Connect? At its heart, it's a relatively simple system. It's an online consultation platform. It allows you to go online, fill in a quick questionnaire that asks a couple of key questions on any particular topic. That might be a cough, a cold, problem with a rash, sinusitis, any of those sorts of things. And there's a specific questionnaire for lots of those conditions. It will ask you some relevant clinical questions that then means our triage team know the best way of supporting you. And that might mean that we need to get you an urgent appointment that day, or that we can signpost you or provide you with some advice to help manage that. We're hoping that System Connect will become our sort of new front door to the practice, and we will be sort of over the next few months pushing to get more and more of that triage contact through to System Connect. That will mean that if you do phone up, our receptionist will be going through those same questionnaires over the phone as you would get if you were to go online and do it yourself, which will likely mean it is much quicker if you're able to go online and fill in a System Connect questionnaire yourself, but we will still have that option to call us, speak to our receptionist, and they can fill that questionnaire out on your behalf over the phone. It will interact with all the current systems we have for online access, including sort of our website, the NHS app, etc. And we are hoping will really speed up that communication with us. Now, we've just got a short video here that just details how System Connect works. So this is just a quick overview of some of the sort of clinical questionnaires that we will have live on System Connect, covering a multitude of different problems, as you can see, be that sort of new conditions, such as we said, those that would routinely end up on triage, as well as looking at some of our sort of longer term conditions and annual reviews. In addition to that, there will be a number of sort of administrative requests that can be sent through System Connect. The big one here really being things like fit note requests, where we need to get some information from you about why that fit note's being requested, how long for. Sending that through System Connect will allow us to request all that information up front and mean we've got everything we need from you to be able to do that quickly and smoothly. As I discussed a minute ago, there's a number of different routes that we might be using then to contact you once you've submitted a response. We might call you back in a similar way to we would with our current triage service, and that will, where we need a bit more information or we need to discuss options, that will be the sort of default route we would commonly be using. It might be that we email you or send you an SMS with a link to self-book an appointment. So we might have enough information in that System Connect to go, you're going to need to come in and see one of our lovely GPs. We'll send you a link. You can book an appointment then at a time that suits you. It might be that we can just send you some additional advice and information on how to manage that condition. And again, we'll email that or SMS that out to you. And it might be that at times we will direct you to a suitable alternative provider, which might be someone like Wiltshire Health and Care for their physio team, or Q's that run the urgent eye care service, or one of the community pharmacies who are able to provide support through Pharmacy First. Obviously, this would all be dependent on the information that you give us and what's felt appropriate by our clinicians at the time they're reviewing it. But having all of that information up front will make sure that we're able to direct you to the most appropriate person to deal with that query. We discussed medication requests as well. As I said earlier, from the 17th of July, we will stop taking telephone requests for medication unless you're registered with us as being housebound. We have a number of other mechanisms that you can use to request medication, such as NHS app, online with System Online or through System Connect, dropping off a repeat prescription or posting it to us, emailing our email address, or via your pharmacy. All those services will still be available, and you'll still be able to order medication through those systems. But it is something that we felt we can no longer take medication requests over the phone, and that is in line with most other GP practices at the moment. At which point, that's sort of all the information we really wanted to convey to you. We're very happy now to take any sort of questions or any information, and answer any questions you might have. So there should be a questions box on the Teams window. If you can submit your questions through there, myself and Elaine will do our best to answer them. Just waiting to see if we get any questions coming through. So we've had a question come through from David Hughes asking how would you connect to the new system, which I think is a very good question. I can do a quick demonstration of that now. If you just give me a second, I will get that up. The short answer is it will be on our, we will have it on our website as a link directly from our homepage, and shared out with patients sort of in advance of it going live, because we're not quite ready for it. Because we're not quite ready to turn it on yet, we're not sharing the URL completely. But if I just share my screen with you, you'll be able to see what you would get when you access it through the website. You'd get a system that looks a bit like this. You can log in with your NHS email account or a System Online account, and then you would get there's a couple of buttons here about what sort of request are you trying to make. If it's an admin request, for example, filling in a fit note, press through. You'll get a number of sort of questions here about why are you requesting a fit note, when would you like it to start, when's it going to end, and you can fill that all in. If it's about a new condition, you'd select new condition. Here, you're going to have a few more choices about what's the condition that we're trying to treat here. For example, if it was a UTI, you'd select UTI. It's just going to make sure this isn't something serious, at which point you're going to be directed to 999, as is fairly standard. At this point, there will then be a short questionnaire that you fill in just about some of those key symptoms. That really helps us understand what is the problem, how severe is it, and it will make the process of us triaging you much quicker, because we'll have that information up front. We'll then be able to say, yeah, this is the help and support you need. It might be that we then text you to say, yeah, we've done a prescription for antibiotics, you can collect it, or we ask a few more questions, can you bring in a urine sample, etc. But that is the system, and that's how it would look. There's another question here from Stephen Brown asking if it'll be on the current website. Yeah, the changes haven't been made yet, but we're getting it already in the background. It will be the current Sarum Health Group.co.uk, I think is our web address. It will be available from the home screen on there, as well as through System Online if you have that for online access to the surgery. I don't think we've had any other questions through at the moment. We will give it another couple of minutes to see if we get any more questions through. However, if there aren't any more questions, that will be the end. And these changes will be going live on the 17th of July, as we've discussed. We will communicate a little bit more between now and then with some news stories on our website, and texting you all out links to where you can find the recording of this webinar, the video that we shared, as well as a sort of a written explanation of these changes that we're making, that again will be published on our website in the next couple of days. So we haven't had any more questions, so I think we will end it there. Thank you everybody for joining us. Sorry, there's one more question that's just come through. Yeah, that's one that we will answer offline. So yeah, thank you everybody. Sorry to keep you from the football, and I hope you enjoy the rest of your afternoons and evenings.